Greetings, YouTube. Some of my fellow citizens elected a number of conservative politicians into office in my state of New Hampshire this last election cycle. And true to their policy of slash and burn on anything that could benefit the middle class or the poor, they are currently in the process of gutting as much of our current state budget as possible. And one of the things that they are putting onto the chopping block is funding for mental health. See, they don't think that the people in New Hampshire who aren't wealthy deserve mental health. They don't need funding for the mental health programs. Now, this will be the third year running that they will have reduced funding for mental health programs here in New Hampshire. But this year is the first time they've actually designed the policies to completely kick certain people off of the rolls entirely. So there will be people who are entirely ineligible for access to mental health assistance. Some of these people will be children. The bulk of them will be adults. Now, one of these genius politicians made a comment about the fact that, well, the kids, they can get mental health assistance at school. Except these same conservatives have gutted the school budgets as well. So I'm not sure that even any of the schools have any full-time nurses any longer. So I'm not sure who's supposed to be doing the counseling for these kids who are probably already overworked and understaffed. That's kind of like kicking people off the boat and telling them, well, yeah, you can just use the lifeboats. Oh, we didn't bring any lifeboats. Yeah, that's a plan where you throw people into the ocean and you sit back and you watch them drown. And I'm starting to wonder, is that the actual conservative policy here? Kick people off the rolls and hope they just go away. Because I have a serious question for any fiscal conservatives out there. What do you plan on happening to these people we've kicked off the mental health rolls? Okay, you've defunded them. These people no longer have access to mental health programs. What happens to them? I'm deadly serious. I want an answer. Now, I see a couple of different answers to this that I'm probably going to hear. One, they're going to assume that their families will take care of them. That's for those that have families, because not everyone does. But instead of spreading out the cost of these programs across all of the taxpayers in New Hampshire, this would then switch the cost to individual families in an already cash-strapped economy. A second option I can hear people saying is, well, the charities will pick it up, except private charities have always failed miserably at providing enough charity for all the people that need it anywhere, ever, which is why we have public programs. Private charities can't cut it, so we have public programs. Oh, we had public programs until these conservatives got into office. So what happens to these people? I'm really looking for an answer. Because to me, I can see in the real world three things happening. These people are going to find themselves in crisis. They're no longer going to have a mental health system to help them, so they're going to end up being admitted to a hospital. They're going to end up going to the emergency room and then being admitted to a hospital, both of which are going to cost way more than funding the programs that would have given them the maintenance assistance that they are getting now. And the last possibility, of course, is they end up in a morgue, which, unfortunately, for some of them, is probably where they're going to end up. Because mentally unhealthy people that don't have support sometimes don't feel they have any options, which is sad. And quite frankly, I can't shake myself of the feeling, quite possibly, the result that conservatives really want. I'm a firm believer in the concept that an ounce of prevention is worth a pound of cure. Spending money on maintenance programs for mental health individuals in New Hampshire is a prevention measure. It's worth a whole lot more to all of us than the pound of cure we're going to have to pay for down the line. In hospital stays and emergency room visits that now will have to be funded by somebody. I'm not really sure who, because the same conservatives are gutting the programs that helped emergency rooms visits get paid for people who don't have insurance. Because these same conservatives are fighting tooth and nail to make sure that the healthcare reform put into place by the Obama administration gets defunded as well. So where are these folks supposed to go? Fiscal conservatives? People without health care, without any support network, and with no funding for the charity programs that help to cover their expenditures at hospitals and emergency rooms in the past. What do we do with them? Do we just throw them in the street and hope they fade away? Is that what you want? Tell me. I'd like to hear an honest answer. It'd be really spiffy, in fact. Because I'm really tired of this. You're gutting the entire infrastructure of America. Except you're not taking any money out of the military budget, and you're not taxing the wealthy, who 81% of Americans seem to want to do. But you are gutting the programs that benefit the poor and the middle class. And you're taking money out of these programs because you know that the wealthy people that funded your campaigns are never, ever going to be affected by these cuts. So what does it matter to you if the poor and the middle class are left out in the cold?